Hello, everyone. Welcome to the AmeriCorps State and National August monthly grantee call. It's great to be here with you today. I'm Colleen Hollihan, the training manager for AmeriCorps State and National, and I'm thrilled to walk you through a pretty packed agenda today. We do have a few introductions to make on the call, and we're going to kick off with the newest member of the AmeriCorps State and National team, our training specialist, John Paul Sneed. This is John Paul's second day on the job, and he'll be working with me and the ASN team, specifically supporting these calls, our training initiatives, and our symposium planning. So I'm going to pass it to John Paul to say hello in a few words.
Hey everyone, my name is John Paul. My background is in learning and development in the private sector, as well as fundraising in a DC nonprofit. I'm really excited to serve at AmeriCorps and support you all, and I look forward to seeing you all in November. Thanks, Colleen.
Thanks, John Paul. So now I'm going to kick it over to Sonali Nijawan, our director, for her opening remarks.
Wonderful. Thank you, Colleen, and welcome to the AmeriCorps State National team. John Paul, we're so happy to have you. And welcome to all of you. Happy first day of August. Lovely to be kicking the month off with all of you. As Colleen shared, we do have a full agenda for today, which we tend to have every month. So we're really glad that you all can be here. But before we jump into the agenda, we have one additional introduction. I'm so excited to be able to welcome our Chief Program Officer, Danielle Melfi, to the AmeriCorps State National call. Danielle's been with the agency since about April and has been leading the way on program as our Chief Program Officer since she got here. So we're so happy to have her. We're happy to have her introduce herself and share a little bit more about her work. And I think some of you may have already even met Danielle in person. So Danielle, welcome to the ASN monthly grantee call.
Thank you so much, Sonali, for having me. And it is wonderful to meet everyone. I'm happy 1st of August, and I hope everyone is having a good summer. It is a pleasure to be with all of you. And first and foremost, just want to say thank you. We know that the work that we do at AmeriCorps is impossible without the work of all of our grantees, commissions, and partners across the country. So thank you for allowing us to be a part of doing this work together, and really thrilled to have the opportunity to work alongside you. I come to AmeriCorps most recently I was running an organization called Building Back Together, which was a nonprofit focused on passing President Biden's legislative agenda. So as we got some great things done in those first 2 years, was thrilled to have the chance to serve within the administration and in particular at AmeriCorps. Service has always been such a big part of my life, and having the opportunity to be a part of this team at such a critical time in communities across the country was a really exciting opportunity. And I've officially hit my 3 months, and it's been really wonderful to work alongside all of the amazing team and colleagues at AmeriCorps that I know you all have the chance to work with, whether it is ASN or PHA or any of our programs and OGA and ORO and so much more. I'm so grateful for their leadership. And again, just incredibly grateful to be in partnership with you all. I've had the chance to meet Beth in Massachusetts and Jeannie in Wisconsin. I have some Wisconsin and New Jersey roots, working across nonprofit and state government, as well as some advocacy work previously, and hope to have the chance to meet more of you on the road soon, or at some of the upcoming AmeriCorps events. Before I turn it back to ASN and our hosts, I know we've shared some information over email, but one of the big things that the administration is working on right now is Medicaid and CHIP re-enrollment. I know we've shared some information over email, and we'll plug some resources in the chat. But yesterday, the Chief of Staff and the Secretary of Health and Human Services convened agencies across government to come together to really ask us to be all hands on deck, to make sure we're doing everything we can to help individuals re-enroll in healthcare. There's an estimate that up to 15 million people could lose their current Medicaid or CHIP coverage during this re-enrollment period. There was some temporary waivers during the pandemic that allowed folks to keep their health insurance. And now states are able to re-enroll and particularly some of the populations that you all serve are at risk. So we appreciate if you all are doing anything in this space, can provide information to the communities and the clients that you all serve in your work. We'll plug those in the chat. And if you need any more information or any more resources would be helpful, please let us know, and we are happy to facilitate that. But thank you again for all that you do. Excited to be in partnership with you all, and I will kick it back to Colleen.
Thanks so much, Danielle. Really happy to have you here with us today. So we're going to keep it moving in the agenda. We had received a request from a grantee a couple months ago for an update on the agency's open data. So thanks for the request. And today we have Christy Jacobs and David Kurz here from the Office of the Chief Data Officer to share that update. So Christy and David, it's all yours.
Hi. Yes, I wanted to reiterate, Andrea is on jury duty and regrets that she cannot make it today. We are still committed to posting open data on our open data platform. We had a pause with our contract for the open data platform that caused a delay in standing up our system and posting data. We are just starting to ramp up again and being able to refocus on the open data platform. And we are committed to getting the member exit survey data and the DEIA data posted in the first quarter of fiscal year 2024. We expect to publish the Siegel AmeriCorps Education Award usage data by 9/30 this year, September 30th. And we expect to publish data sets as soon as possible. And then we are also committed to creating a dashboard type visualizations to provide more extensive analytic data. So you should expect to see just the data sets published first and then dashboards using Power BI. For the work we are doing with modernization, we are working towards creating an automatic data pipeline for this publishing this type of data in the future to improve the speed at which we can publish data. And once the schedule is available, we will publish it on the ODP splash page and send it out to the commissions. And that is our update. I'm not sure if there were any questions in the chat on that.
Thanks so much, Christy. So we have our Q&A panel open, and we also encourage folks to raise hands if they have questions. So we will take a minute to pause and see if there are any questions for Christy and her team. We've got a thank you in the chat, so some appreciation for you, Christy.
No,
Thanks, Carrie. Christy, will the member exit survey data be broken out by state and national to where they are separate?
David, can you speak to that question?
Sure. Yes. The answer is yes. We can break it out by various sub-programs within state and national as well. So the answer is yes.
Thanks, David. Thanks for the question, Lou. We'll give it one more couple seconds. If folks have questions, and just want to, I should have said this at the top, but the Q&A panel is back for y'all. We didn't have it for a little bit, but it's back now. So I encourage y'all to use that instead of the chat, as it will be able to better help us both respond to and track questions if we cannot get to them today. So I am not seeing any other questions on data right now. So thank you so much, Christy and David, for joining, and we will move it along. We'll send Christy's updates in writing in the call notes after as well.
Thank you.
Thanks all. So we're going to move into updates from the Office of Grant Administration, and we have Amy Hetrick here to share some updates.
Thanks so much, Colleen. Hi, everyone. I'm Amy Hetrick. I'm the acting director of the Office of Grant Administration. Our previous director, Lisa Bishop, left the agency at the end of June. So I've stepped into this this role since then as an acting director. Really happy to be with you all today. Happy August. OTA only has one update today, and it's just to clarify that the carry forward guidance that we sent out, which is applicable to competitive continuations, that is also for public health AmeriCorps continuations. That's the only thing. We did send out an email on that, so I wanted to reinforce that because we did get several questions on it. Since I'm light on the agenda here, I just wanted to spend another moment to just thank you for the work that all of you do every day to run your programs and your commissions. Thank you. Back over to you, Colleen.
Thanks, Amy. I know Amy just had a brief update, but wanted to just give it a couple seconds if anyone had questions on Amy's update. Okay, so we can keep it moving. So we have several updates from AmeriCorps State and National today. I am going to jump right into them. So we're happy to share that the symposium dates went out to you all at the end of last week. We really appreciate your patience as we work to get them. We know that folks were very eager to learn of the dates. This year's symposium will be held on November 28th to 30th at the Washington Hilton in Washington, D.C. So we're excited to be in downtown D.C. this year. Appreciate everyone that submitted nominations for our Excellence in AmeriCorps Awards. We were thrilled at this year's response. The nominations closed last night, and we look forward to announcing the awardees at Symposium, but we'll be announcing them, notifying them prior in the coming months. In terms of Symposium logistics, y'all are going to get these updates in the coming weeks and months as we finalize more details. But in the next week or so, we will be sharing out registration information, hotel information. In terms of logistics for the event, so we're going to be hosting a pre-conference session the Tuesday morning of the symposium. So before we kick off, the pre-conference will be with the Office of the Inspector General. We'll kick off the event around 1 p.m. and then we should wrap around 1 p.m. on Thursday. All conference sessions, so sessions that all participants will be invited to, including our keynote speakers, our plenaries, and our award ceremony will be live streamed. Our workshops and other smaller group sessions will not. We'll feature this year our traditional workshop opportunities, sessions for networking, and we're going to be bringing those collaboration cafes that we had in our virtual symposium to life in DC. So you'll have space to hear from agency leaders from different departments and engage in dialogue with those folks. So as I mentioned, we're going to be sending out additional symposium information in the coming weeks and months, and that's what we have for you for today. So hopefully you're getting excited. We're all really excited to see you in DC in November. Another update is related to the Disability Inclusion Fund. This went out in the pre-call notes, but wanted to let you all know that thus far we've received 3 requests for disability accommodations funds for a total of $3,753 expended. And we have $95,678 in funds remaining. The deadline to submit these requests for funds for FY23 is August 30th, 2023. And I'm going to pop the link, the instructions link to apply for those funds in the chat. So now I'm going to pass it over to Jennifer Bastras-Tomasebi, our Deputy Director, for an update on benefits of business.
Thanks, Colleen. Good afternoon or good morning, wherever this call will find you. I hope everybody received the benefit to business guidance on Monday. If you did not receive the guidance directly and it was forwarded to you, I encourage you to please add your contact information into eGrants. We will include the how to do that in the call notes. So we sent out the guidance on Monday. It came out of the open house that AmeriCorps State and National and the Office of General Counsel hosted on June 23rd. This guidance is likely to be relevant to a specific subset of our grantees, centered mostly around environmental stewardship, and economic opportunity. It will not be relevant for all grantees, but in the event that this guidance is relevant to your program or sub-grantees in your portfolio, they will need to take the following steps. So the first is they would need to make a decision if the program or your sub-grantees want to expand or contract their activities based on the guidance. Then they would need to determine whether that requires an amendment due to expanding the scope of services or contracting the scope of services. The way that people would assess whether they need to do an amendment is by reviewing their grant application or their sub-grantees applications. Some of you may find your descriptions of service activities and or host sites is expansive enough to cover the new activities and or host sites, in which case you would not need to take steps to do an amendment. Others of you may find that your description of service activities and or host sites is more specific and does not cover the new activities and or the host sites that you hope to serve with. In that case, you or your sub-grantees would determine that an amendment is needed. If it's needed, we have created guidance about initiating, processing, or requesting post-award amendments on ASN grants that we provided on Monday so that you can walk through that process. It's also available on AmeriCorps.gov under the Access eGrants instruction filter. Some amendments that will be relevant to the situation could be revising the narrative, changing the service area, modifying awarded slots, members, modifying performance measures or work plans, or modifying sub-grantees. You may find that there's another amendment type that would be most relevant, but those were the ones that came to mind for us. You are welcome to consult with your senior portfolio managers or your portfolio managers as sounding boards, but ultimately this is a grantee decision. And for grantees, for state commissions, they could decide what the process is for sub-grantees. Once grantees submit the amendments, the PM or the SPM will finalize the amendment. You all know that your PMs and SPMs have been working through amendments with you all on other work, but just wanted to highlight that we are getting some late breaking guidance from our Office of the Chief Program Officer that is a little more user-friendly for all of our colleagues here at the agency to move speedily through approving the amendment. So that's our update. And we really, really appreciate all of the grantees and sub-grantees that came out to participate in the open house, because it really allowed us to have all of the examples that you all put in front of us in order for us to be thoughtful about issuing the guidance. Thank you.
Thanks, Jennifer. So we do have a couple questions in the Q&A panel. So I'm just going to go backwards, starting with benefits of business, and then I'll cover symposium. And it looks like we snuck one in there for OGA as well. So we will move through this. So the first one is, what do we do if we have additional benefit to business considerations that are not addressed in the first guidance? And the follow-up, I'm asking about pre-clearance in future grant applications. Jennifer is kindly and thoroughly describing amendments. I'm wondering what to do for new start benefit to business ideas.
So if you have ideas, if you were not able to attend the open house, which is totally fine, and you have other ideas or scenarios that you would want to run by us, feel free to send an email to asninformation@cns.gov, and we will be happy to look into those. I think if we will probably give it 2 weeks to see what comes in. If it necessitates us creating or adding to the guidance, we are happy to do so. Does that answer the question?
I believe so,
Okay.
Jennifer.
Great.
We have one more on benefit to business. If we have questions regarding a program looking to operate in an area that falls slightly outside of the published guidance, who should we contact? ASN information?
Yes, I would do that because this is a relatively new space for us to offer guidance. We will, of course, loop in and work with your PM and your SPM. But because the guidance was released from AmeriCorps State National and the Office of General Counsel, we probably could start there and then have you work through your PM and SPM as we progress. But again, totally welcome additional scenarios that people have, as we're really committed to getting clarity around an important issue. So thank you.
Thanks, Jennifer, and thanks, folks, for the questions. I don't see any more on benefit to business. We are going to have open Q&A, time permitting, at the end. So if you didn't get your questions in now, we can squeeze them in later. So I'm just going to go backwards. So next to the questions on symposium, what staff position is the target audience for? So we'll have, so all prime grantees are required to send staff representatives to symposium. We will have content catered towards brand new to AmeriCorps program staff all the way through seasoned vets who have been working in the fields for a while. So the content will focus on operating our AmeriCorps program, compliance, as I mentioned, opportunities to speak with some of our leadership. So we'll be sending out more details soon. And if you have specific questions about who may or may not or should from your organization attend, I'd encourage you to talk to your portfolio manager. Thanks for the ping on the July ASN grantee call being added to our YouTube playlist. We did send out the recording link and may have missed the upload to the list. So we'll make sure that gets done this week. Appreciate that. Question on extra time or dates that planning grantees should plan for. I'm assuming this is related to symposium. All of our planning grantee content will be built into those 3 days, so there won't be additional days for you to come early or stay late. And then lastly, I'm going to kick it back to Amy to quickly answer this question on for OGA. How long are we still using the PMS?
Thanks for this question. So PMS, our payment management system, the bank account for all of your awards, we have an ongoing relationship with PMS. There are no plans to discontinue using PMS at this time. I think that this question may have been asked in the context of the recent change where PMS stopped the way that it was the quarterly cash transaction reports. We did send out a message at the end of March about that change, and you can find that correspondence on the Manage Your Grant page, where it talks about what did change, what and also any additional information about the PMS system. So I believe that resource on the Manager Grant page will be helpful, and I will put the link to that particular resource into the chat. So I hope that answered your question. Great, thanks.
Thanks, Amy. I am going to unmute Michael. Assuming, Michael, you have a question related to these topics, feel free to unmute and ask your question.
Thanks. This is Mike at the Maine Commission, Mike Ashmore. A quick question regarding the benefit to business guidance. And first, I can't tell you how pleased I am to see written guidance around this. I've been doing my job here for 13 years and have been asking for this pretty much that entire time. So bravo to you folks for putting it in writing. I would just like some clarification on the final 3 unallowable service activities, because they include both education about and then either installation or an actual audit. And I understand the installation and the audits being unallowable, but I struggle with education being an unallowable activity. Many grantees offer public education to anybody who shows up. And if a farmer comes in or if a for-profit business comes in and says, you know, I want to know more about solar installation subsidies, we're not going to have much control over that. So maybe a recommendation or some clarification about the difference between the type of education that you guys are saying is unallowable. Because I can clearly see the and parts being unallowable, but I'm a little concerned about the breadth of something like education to the public being unallowable. Also, just a little concerned, or I guess a wondering for me, because I don't really understand what we're talking about for scenario 3 under unallowable service activities. What does it mean to connect a grocery store to resources?
Hey, Mike, it's Jennifer. Thank you for your appreciation for us providing the written guidance. We could not have done that without all of you. And I guess we can file this under better late than never, and commit to keeping on top of scenarios as they come up. I hope that people can see that both AmeriCorps State and National leadership, as well as the Office of General Counsel, worked really hard to get to yes on the places that we could. Unfortunately, the last 3 scenarios at the end, we were not able to get to yes. I think the challenge, I hear you about education being an important component. I think the challenge is that the education was in service to benefiting the business in terms of cost savings related to all of those issues. If you feel that we have misunderstood, or you want us to look at it again, I'm happy to do that. Mike, I'm happy to call you offline to have a longer conversation about it. But those were the ones that we could not get to yes, we feel pretty comfortable with. So barring any new information, or any misunderstandings that we may have had, it seems unlikely that guidance will change. But again, happy to engage in a conversation about it. In terms of the scenario with the grocery store, I do not have the thing pulled up right now. I believe I will have to follow up with you. I don't have it right in front of me, and I don't think it's a good idea for me to guess. But I may come back on a little bit later in the call to follow up.
Thanks, Jennifer. And thanks, Mike, for the question. So we are going to keep it moving as our Q&A box. Amy's working on a question now, but we're going to keep moving forward. So for those of you that may be new to the call, we are moving into our What's the Buzz segment. So we get these topics from our colleagues in the Office of Regional Operations as they are interfacing with all of you on a regular basis and letting us know what the buzz is in the field. So considering the time of year, we thought this would be a great opportunity to share some tips and tricks on navigating the CFR and the terms and conditions. And we have our portfolio manager here, Andrew Pollocky-Sinclair, to share this wisdom with you. So Andrew, it's all yours.
Thanks so much, Colleen. Hey, all. As Colleen mentioned, I'm Andrew Pollocky-Sinclair. I'm a portfolio manager with the Office of Regional Operations in our North Central region, coming to you from Kansas City, Missouri. So it's really such a pleasure to be with you all today. So I'm here to talk to you about navigating terms and conditions and the federal regulations, give you a few quick tips and tricks. And there are really 2 main reasons for this. The main one is as a portfolio manager, and for all of us, I may be taking a leap, but the most rewarding part of my role is when we get to empower our grantees and partners to be able to navigate these resources and find answers so that you are able to be effective in your program and equipped to be compliant and really navigate some of these things which can be complicated. And the other reason is when you ask us questions, we are most often going to go to these exact same resources. So if you know how to also navigate these in search, we can have these conversations and we can have you equipped to read along with us and really have a good dialogue, again, to increase compliance and effectiveness. So one of the quickest ways to reach your, for example, terms and conditions is going to be to go to our website, AmeriCorps.gov, and you'll go to the grantees and sponsors section, which I've highlighted there up top. And if you're a state and national direct grantee, you would click on that highlighted link there. And if you are one of our commission partners, of course, you would go to the one above. And then once you're in there, there's this really helpful drop-down menu, and you can select View Terms and Conditions and click Apply. And it'll give you the terms and conditions going back a few years that are relevant to the work that you all do. So if you can go to the next slide, please. So when you click on your terms and conditions, which you should always click on the ones that are assigned to the fiscal year in which your grant that you are operating was awarded, those are going to be the terms and conditions that are applicable to you and that you should follow. You can pull those up and they're going to be really, really helpful. And we've distilled a lot of the regulations and financial grants management and AmeriCorps policies and procedures into these terms and conditions so that you can navigate those. You can use Control F, you can go to the tables, a table of contents, you can look through these, and you're most likely going to find the answer. So here's an example I put. Say you have a question about, gosh, when can I refill a member position? What were the requirements for that? How much of that term could they have served? Because these are questions that can come up, and I don't expect you to memorize those. I certainly don't always remember. I have to go check if someone asked me that question. And there it is, refilling the member position. So there it is. It's a really complete answer, and it's right there in the terms and conditions. The other example I put here is another one where you say, okay, I know that there's limitations on fundraising that state and national members can do. What are those? And you go to the terms and conditions and Control F, and there's a fundraising section right there. As you can see, it gives a lot of the answer, but it doesn't give every single piece of that. And that's a good thing, because if we took everything from the Code of Federal Regulations and everything from the statutes and put it in the terms and conditions, well, they would end up just as long. And that wouldn't be very helpful to have the terms and conditions. So in that case, you see there's a citation, and you can go over to the Code of Federal Regulations to view that citation. So let's head over to the CFR. We can go to the next slide. There's a link that if you go to view governing authorities and guidance, you can see here's a link. Specifically, it'll take you to the uniform administrative requirements. I will give a plug to that later. But what it also does is just takes you to the whole ecfr.gov website, which is going to be the best way for you to find, most importantly, the most up-to-date. And it shows changes that have been made to the Code of Federal Regulations. So you would click on that link and it would take you to ecfr.gov. So if we can go to the next slide there. And there we go. We go to that citation, Title 45 for Public Welfare, which is where all of the specific AmeriCorps regulations are housed. You will see, there we are, the Corporation for National and Community Service, which of course is still our statutory name, even though we are AmeriCorps. So you would click on that. There's section 2500 within Title 45. And there's the raise resources option right there on the right. So you click on those links, and there it says, exactly, the percentage of time and specifically what kinds of fundraising they can do, right? Because state national members are limited in what kinds they can do. Here it is all laid out. So you can find it. It's right there ready for you. And if we can go to the next slide as well, please. I'm going to also give another plug, a final plug for the uniform guidance. So those of you who have worked with federal grants for about a decade, a little over a decade, you'll remember the OMB circulars and all the different other places you had to check for financial grants management. This is the uniform guidance. It's all in one place when it comes to your financial grants management questions. And it is, in my opinion, such a great thing to have it right here, accessible in that one place. So when it comes to our due diligence requirements, it's all derived from the uniform guidance for your financial grants management. This is the place where if you have questions about allowability of costs, that's just something I highlighted here because I feel like we get a lot of questions about when is a cost allowable, and of course allocable and reasonable. That's all talked about in the uniform guidance. So you can go through there, look and see what all of the different qualifications are for those specific pieces, and It's right there. And then you can look up the citations, have your questions, have a check-in with your portfolio manager, and then we're going to be so well equipped to reach that decision together to be compliant and effective with federal law, regulations, our terms and conditions, and you're going to have the best, most effective and compliant program ever. So thank you all so much. And I will pass it back to Colleen.
Thanks so much, Andrew. Really appreciate the wisdom here and the work that you and all the portfolio managers do every day to support the grantees. So appreciate this bit on the call this month. We can move ahead to the next section. So we have an update from Public Health AmeriCorps. So here today with us is Maika Sanderson, the Deputy Director of Public Health AmeriCorps. All yours, Maika.
Awesome. Thank you so much, Colleen, and good afternoon, everyone. It's always a pleasure to be able to spend just a bit of my Tuesday afternoon with you all. So today we actually have a number of updates in regards to the Public Health AmeriCorps program. So strap in and kind of stay with me. I know that we're heading towards the end of our call. So first of which, we know that there's been a lot of interest in understanding, will there be future funding opportunities for Public Health AmeriCorps? And as you all may know and have been hearing in the news cycle, the Fiscal Responsibility Act of 2023, often referred to as the debt ceiling deal, has called into question some American Rescue Plan Act funding. We're working really closely with our partners at CDC to understand the impact of the legislation on Public Health AmeriCorps. As those conversations are complex and ongoing, AmeriCorps has decided to offer a continuations-only funding opportunity for existing PHA grantees in FY24. As we know more, we will be sure to provide you all with more information. Next on the docket today, we are talking a bit about PHA evaluation. Hard to believe, but we are rounding the bend in just a year and change in terms of, members in service, and we're really excited about that. We have sent out a grantee survey. You all should have received it a couple of weeks ago. If you haven't finished completing it, please make the time between now and August 10th. That's the deadline, so that we can get that really fantastic information to understand what have been your implementation experiences thus far with the program, so that we can continue to build out the resources that we're providing to you all and support you in the ways that you need it the most. So please go ahead, dig into your email inboxes, find that link, and please complete that survey. The other thing I want to flag for you all also in the kind of realm of evaluation is that we are, in addition to having issued the grantee survey, we will be issuing a member survey. We really want to understand the long-term and short-term impacts of our program on our members. Are we influencing young individuals and older individuals to get into a career of public health? And the training and resources that we've provided to them and that you all have provided throughout their member service experience, what kind of impact has that had? Do they need additional support in terms of developing skills, etc.? So we've started to design a member survey, but we need some testers, and who better to test it than the members themselves? So if you can flag this opportunity for your members, let them know that we're looking for a few pilot folks to give our survey a go, that would be fantastic. If you are a little worried of like, oh man, this is a lot of reminders, don't worry. These things will also show up in the grantee newsletter that's going out this week. So you could just go ahead and copy and paste and send it out through your communication channels to your members. Next slide, please. More goodies for our members. We have the PHA Speaker Series. Our next installment is actually next month, Thursday, August 10th, 3 p.m. Eastern. We will have Dr. Sakobi Wilson, the director of the Center for Community Engagement, Environmental Justice, and Health at the University of Maryland, and they will be talking about their public health careers, experience in the arena and area of environmental justice. So very cool intersection of these two spaces, and such a great way to kind of flag for our members that, public health is really broad and has quite breadth and depth, and there's a space for them in it. So please encourage your members to attend. Registration link available on the slide also will be in the Grantee newsletter. We want them to have the opportunity not only to hear from Dr. Jacoby, but also to ask questions. Another friendly reminder for the group, CDC trained foundational training. We do expect that grantees are encouraging their members to take that public health foundational training found on the CDC Train online platform. It's at no cost to members. They simply register for an account and complete that 16-hour training before the end of their service opportunity. This is really critical to the member service experience and provides that foundational understanding of what is public health and what are some of the skills that are needed in order to be successful in this area. So please make sure that you are reminding, encouraging your members to complete that training. Questions about getting into the system, how to register, etc., please reach out to publichealth@americorps.gov and we're happy to help. Last but not least, as I had mentioned, oh boy, it's almost a year of members being in service, at least for some of our members. So, we really want to make sure that we're able to capture contact information for our members before they end their service opportunity. So if you all as grantee organizations and reaching out to your host sites, reminding those who are managing members to encourage members to update their contact information in the My AmeriCorps portal, that is key. We want to be able to reach them after the end of their service opportunities so that we could provide those additional resources that bridge that service opportunity into a career in public health. So us being able to reach in your inboxes and provide some additional information and resources and job opportunities from partners is what we want to be able to do. So please do help us in those efforts. All right, I think that is it, Colleen. Thank you for the time. And this was we can move ahead. I know that we have a pretty packed agenda.
Thanks, Maika. We do have just a couple questions in the chat I wanted to send your way. I just put the registration link for the PHA speaker series in the chat. First question, how many PHA members are there?
Great question. So we funded 7,000 slots. At this time, we have over 1,400 members that are actively serving or alumni.
Great. Will grantees receive the PHA member survey results?
That's a great question. Yeah, so there are plans in the evaluation contract that we have going with JBS for them to share out some of the findings. So I do believe we'll be sharing out at least some of the information that we find from those activities.
Thanks, Maika. Just a couple more. Can non-PHA members attend the speaker series?
They certainly can. We welcome them as well as grantee staff. Yes, that is totally allowable.
Great. We got that knocked off 2 questions. Are you expecting both commission prime and subgrantees to complete the survey?
That is a really good question. So from my understanding, the grantee survey would have gone to project directors listed on those grants. So I am not certain if it's going direct to state commissions as well, but let me check. My understanding is it would go to the sub-grantees, but great question. I will follow up with ORE on that.
Great. Thanks, Maika. So last one, I'm just going to bundle it because part of it is for ASN. And we can get Maika's follow-up to the previous question in the call notes as well. So there seems to be significant time and resources dedicated directly to member training and professional development for PHA members. Is this something that will be replicated with other ASN programs? In terms of the ASN competitive grant program, there are no plans at the moment to incorporate member training. This is a special, unique factor of the partnership with the CDC and Public Health AmeriCorps. Certainly, welcome any feedback around future trainings that the ASN team provides as we expand our training team. And then the next part of the question, and then we'll move ahead, is for you, Maika, what does alumni outreach look like for PHA members? Will this be a pilot leading into more broad alumni engagement?
That is a really fantastic question. So our training manager is developing exactly what that outreach is going to look like. So we are still in the process of kind of finalizing what that is, but in part, we work with a number of public health related kind of associations and institutions. They often have kind of a pulse on what jobs are available. So that would be kind of the first slice of, we'd love to send a roundup of career opportunities and other kind of webinars that are building skills for our members who completed service opportunities, but definitely more to come on what that alumni support is going to look like.
Thanks, Maika, and thanks everyone. Really great questions. So we're going to move ahead. If we can back up a slide. There we go. So we're excited to bring back our program spotlight feature. We had a couple months off of it, but here today we have a Public Health AmeriCorps grantee, a sub-grantee of the Michigan Commission. We have Kayla Doyle here from Cherry Health to share more about their program. Thanks so much for being here, Kayla, and you can take it away with your program update.
Hi, everyone. I'm so happy to be here to share some about our program. My name, again, is Kayla Doyle, pronouns she, her, and I'm the director of Cherry Health AmeriCorps in Grand Rapids, Michigan. So I've been with Cherry Health and AmeriCorps since 2008. I first joined Cherry Health as an MSW intern, and then I signed on for 2 terms of service with Cherry Health AmeriCorps. After my terms of service were finished, I was hired as the program assistant to our AmeriCorps program, and then I was promoted to director about a year later. So while we are a new Public Health AmeriCorps grantee in 2022, we have had an AmeriCorps program at Cherry Health since 2003. So we're going on 20 years of AmeriCorps service at Cherry Health. And our goal has remained the same over those 20 years, and that is to increase access to healthcare to the underserved in the greater Grand Rapids area. One of the main activities we have always done as part of our program is Medicaid outreach and enrollment, which includes CHIP. So we provide that outreach service to patients in the community. Having health insurance is one of the most important keys to healthcare access, and applying for Medicaid and CHIP and keeping that coverage can be really challenging and confusing to people in that process. So our members help our patients in our community to obtain and apply for that health insurance. And it makes it more achievable, makes it less stressful when you have an expert on your side helping you. So currently we are involved in that post-pandemic Medicaid and CHIP redetermination process. Another major component of our program is health education for breast, cervical, and colorectal cancer screenings. So due to pandemic restrictions, a lot of people got behind on those routine screenings, which is anticipated to have increased late stage diagnosis and increased death due to breast, cervical, and colorectal cancer. So our members are diligently using reports that tell us who's due for one of those cancer screenings, outreaching to those individuals, providing health education so that they can overcome any hesitations or fears those individuals might have about getting those screenings, and then make sure that they're scheduled to receive that screening. So that's going very well for our program this year. So those are our 2 primary activities. We also have a lot of other activities we do as a program. For example, we run a really robust reach out and read program. In this program, pediatric patients ages 0 to 5 receive a book or sometimes more as part of their well child visit. And this really helps to encourage developmental milestones. So we're giving education to the parents on the benefits of reading and bonding with their children, and they get the book where they can do that at home. And we take a lot of care in selecting our books. Our AmeriCorps member does, to make sure that our patient population is reflected as far as diversity and any other uniqueness such as language or however a patient might identify in those books. We also, as a team, ensure that Cherry Health is able to provide culturally and linguistically appropriate services by providing Spanish and English healthcare interpretation services. So we do those primarily at medical and behavioral health visits. And that consistent interpreter presence really helps our patients to build trust and improves our quality of care. Annually or through our program year, it's estimated, well, I would say on average, we provide over 125,000 minutes of interpretation assistance. So we do a lot of interpretation. And we reach a lot of other patient populations who are at risk for poor health outcomes through our other member placements. So the LGBTQ+ population is one that we highly focus on. We also help families with new babies obtain car seats and pack and plays at no cost and provide them health education on safe sleep and car seat safety. We coordinate a food pantry that's located within a health center so that patients can come in for their visits. And if they have a food or clothing need, they can go directly to that pantry and walk out with that need met. And we screen individuals for social determinants of health so we can connect them with community resources to help them overcome that barrier to care so they can be healthy outside of what happens in the health center too. So we have members placed at Cherry Health and members placed at external partner organizations to achieve all of these goals. So essentially, our program is really able to build a safety net of healthcare services for all of the underserved across Grand Rapids and the greater Grand Rapids area. Our members are diverse and reflect the patient population that we serve. So we have a very dynamic team. We get together twice per month for team meetings to engage in personal and professional development and build esprit de corps. We also go out into the community at least once per month to do a service project at health-focused nonprofits like Gilda's Club, Meals on Wheels, and Habitat for Humanity, plus more. And our members consistently say that that's one of their favorite parts of service. And they get to network, and some people even get jobs from those connections. So that's really cool. In addition to the Public Health Foundational training, our members receive training for community health worker certification through an organization called Everyday Life Consulting. And if they do provide interpretation services, they provide medical interpretation training so at the end of their term of service, they can sit for that certification exam. So they're walking away with industry recognized credentials to improve their educational career prospects after service. And as an alum of the program, I can attest that most members will walk away from their term of service with a friend for life. We even have several couples out there who met in AmeriCorps service and now are life partners, which is so heartwarming. So my hope is that all of our members can use a service experience as a way to gain self-awareness, which really is the key to self-actualization. And they can go forth knowing how to get things done. They can take action in the face of apathy, seek common ground when in conflict, and persevere through adversity. So I'm proud to be an AmeriCorps alum and continuing to get things done through Public Health AmeriCorps. So thank you for giving me some time to talk about our program today.
Thanks so much, Kayla, for being here today, for sharing your story and for your own service. My heart was really warmed by your Amera couple stories as one half of an Amera marriage. So thanks for being here again, and thanks for all the great work you're doing in Michigan. Appreciate it. So we do have a few minutes left for Q&A. I see one question in the chat, or I'm sorry, in the Q&A. Feel free to also raise your hand if you have questions. So the first question that we have here is, when will the Siegel Ed Award amounts be posted for fiscal year 2024? I am not aware of that. I think this is something we could follow up. Going to pause quickly if anyone on the ASN team is aware. If not, we will follow up in the notes after connecting with our colleagues in the trust.
Colleen, this is Jennifer. We can follow up with Jerry and the folks at the trust.
Great, thank you. And thanks for the question. Give it another couple minutes if folks have any questions. Again, please put your questions in the Q&A box or feel free to raise your hand. Great. Well, I'm seeing our folks start to drop off in the attendee list, and I don't see any questions. So I am going to wrap us up, or I'm going to pass it to Sonali to wrap us up. Thanks all.
Thanks, Colleen. Thank you all for joining. And thank you to Kayla for sharing your story and the story of service happening at Cherry Health. We really appreciate it. And I hope you all have a wonderful August. Take care. See you next month. Bye-bye.